अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे एमसीक्यूज अबाउट फ्रैक्चर मैनेजमेंट। एमसीक्यू नंबर 1, प्रॉब्लम नंबर 1, अ 75-year-old woman who slipped and fell on her outstretched hand is brought to the emergency department. She complains of pain in the area of right wrist. On examination, there is deformity in the area of right wrist. The wrist has the appearance of dinner fork deformity. There is significant tenderness over distal radius. Both the pulse and sensation distal to the injury are completely normal. What is the most likely diagnosis in this patient is Cole's fracture. What is the treatment of choice for this patient is external reduction and immobilization. Problem 2. An 18-year-old basketball player is brought to the emergency department after falling on his outstretched hand. He is the league's loading saucer and his coach directs you to fix it fast. On examination, there is slight tenderness and swelling just distal to the radius in the snuff box. No other deformities are found. Radiograph of wrist and hand are normal. What is the most likely diagnosis? Fractured scaphoid. 4. What is the treatment of choice for this patient is active physiotherapy, passive physiotherapy, NSAIDs, surgical exploration of wrist, none of above. What is the major complication that can happen with the injured described in this case is avascular necrosis of bone. Problem 3. A 25-year-old man with pain in his ankle is brought to the emergency department. He complains of severe pain in the area of right ankle and is unable to bear weight on foot. On examination, there is swelling of entire right ankle with more prominent swelling on lateral side. There is point tenderness over lateral malleolus. There does not appear to any other deformity or abnormality. What is the most likely diagnosis in this patient is fractured distal fibula. What is the initial treatment of choice for this patient is immobilization of ankle. Which of the following statements regarding acute compartment syndrome is true? All of above. Acute compartment syndrome is caused by increased pressure with enclosed facial space as a result of swelling from injury. Acute compartment syndrome is found primarily in the lower leg and forearm. Acute compartment syndrome may lead to muscle and nerve ischemia and even permanent damage. Acute compartment syndrome patients frequently have pain with passive stretching. Which of the following is part of Ottawa ankle rules to determine the need for radiograph in evaluation of ankle injuries? All of above. Bone tenderness at the posterior aspect of distal lateral malleus, bone tenderness at posterior aspect of distal medial malleus, inability to bear weight on the ankle after the injury, tenderness at the base of fifth metatarsal. 10. The emergency treatment of traumatic orthopedic injuries include which of the following? All of above. Assessment of ABC, assessment for vascular and neurological injury in the involved region, correction of deformities, splinting और immobilization of all injured areas. उम्मीद है ये MCQs आप लोग के लिए हेल्पफुल रहेंगे। थैंक यू सो मच।